So Lina, I want to talk to you a little bit about nervous patients, because quite a large majority of people have some degree of fear of the dentist, and some people are so scared that they can't bear the thought of coming in. But here at A&L Clinics, obviously you specialise in helping nervous patients, and what can you do to help anyone watching that needs to come to the dentist or needs to come regularly but is a bit scared?
Okay, as I'm a sedationist as well, I can sedate the nervous patients, basically put them to sleep during the treatment, so they wouldn't have any bad experience, they wouldn't remember anything the next day. Conscious sedation is like you have a small injection in your vein on your arm or back of the hand, and the drug is titrated in your system. It's a diazepam-based drug, and it puts you to sleep and relaxes you really well, so you are not aware of what's going on. But it's conscious sedation, so if something happens, I would be able to communicate with you, and I would be able to ask you to breathe or open your mouth, but that's it. You will not remember anything the next day. So it's really handy, because I have loads of patients who are anxious and they don't even want to come and have a consultation or sit in their chair. But most of them are really happy with this treatment and they can't do without.
Mm-hmm. And are there any problems or side effects with the sedation, or can most people, if they're absolutely petrified, they can have that?
Most people can have that. There's not many conditions. Of course, if you are pregnant, again, you can't
Mm-hmm.
have it. Most of the people can have that with no problems. The only thing, they can't go back to work the same day. They would have someone to look after them that day and take them home. We wouldn't let you out in the street half asleep.
Wandering around.
Yeah, wandering and buying things which you don't really need.
But if there are people that maybe aren't at the stage where they feel they need to be put out, but they're just a little bit nervous, what would you say to them about perhaps thinking about coming here instead of somewhere else?
If someone doesn't want the intravenous sedation, we can always have pre-medication, which is, I would prescribe you some pills that you take in the evening before and just before the treatment, that would put your mind at ease and help you relax. So that is helpful as well. Some people are so petrified that they have to have both.
Really?
Yeah.
Wow. It is a common fear, but it's a very friendly clinic here, and everybody's made to feel very welcome and relaxed. So hopefully the majority of people who come here realise that it's not quite as scary as they thought.
No, it's not an old-fashioned dentist, not a dentist from horror films. It's a nice, friendly environment, and trust me, you will be joking with us soon.
You'll look forward to your next appointment,
Yeah,
I'm sure.
Definitely.